You know how a toothache can turn an ordinary night into a hostage situation. One tiny point inside your mouth starts pulsing, and suddenly the entire universe becomes that tooth. You cannot sleep properly, you cannot eat normally, you cannot think noble thoughts. You become a person negotiating with a nerve. Maybe you hold cold water in your mouth like a ritual. Maybe you press your face into a pillow and promise to become a better person if the pain stops for 5 minutes. Then, in the modern world, you can call a dentist. Now remove that option. No dentist, no x-ray, no numbing injection, no antibiotics, no clean drill, no root canal, no pharmacy with little bottles that pretend to be mercy. You are an early human and the same deep electric pain is inside your jaw. The tooth is cracked, infected, worn down or rotting. You still have to chew, you still have to walk, you still have to help the group, sleep near the fire, and wake up tomorrow with the same mouth attached to your face. So how did early humans survive tooth pain without dentists? That question sounds small until you remember what a mouth is for. Teeth are not just decorations for smiling in photographs. Teeth are tools. They cut, tear, grind, hold, carry, and begin the process of keeping the whole body alive. If a tooth failed in the ancient world, it could change everything. What you could eat, how much energy you got, whether you slept, whether infections spread, and whether you could keep up with the people who depended on you. Your ancestors did not live in a painless world. They were not magically tougher because they had no appointments to cancel. Pain still entered the jaw, infection still swelled, nerves still screamed. The difference is that they had to face it with plants, pressure, fire, sharp tools, patience, group care, and whatever knowledge had survived from older mouths before theirs. A toothache was not just discomfort. It was a survival problem hiding inside the smallest bone-white object in the body. Here is the reframe. Tooth pain was not a small medical inconvenience. It was a threat to the whole survival system because eating is the first job the body has to keep doing. A sore tooth could make hard food impossible. An infected tooth could turn sleep into punishment. A swollen jaw could make talking, chewing, working, and paying attention harder. In the deep past, pain did not politely stay inside the mouth. It spread into the day, into the group, into the body's ability to keep going. Modern people often separate dental problems from serious health, as if a bad tooth is just an annoying appointment waiting to happen. But before modern dentistry, the mouth was a dangerous place for trouble to begin. A crack could expose sensitive tissue, a cavity could deepen, bacteria could enter the root, an abscess could build pressure under the gum and send pain through the jaw, face and head. And if infection moved beyond the tooth, the problem could stop being dental and start becoming life-threatening. So the real question is not how early humans tolerated tooth pain. The real question is how they protected the body when one of its most important tools began to fail. They could change what they ate. They could soften food with cooking. They could use plants, chewing sticks, smoke, pressure, or sharp objects. They could pull a damaged tooth if the pain became worse than the wound. And just as important, other people could help, sharing softer food, caring for someone who could not sleep, and keeping them inside the group while they recovered. That is the key. Tooth pain was not only a private ache, it was a test of knowledge, endurance, and social support. A bad tooth could isolate a person inside their own skull. Survival meant finding ways to keep that pain from taking the whole body down with it. To understand ancient tooth pain, you have to imagine a mouth doing more work than most modern mouths ever do. Your ancestors did not eat only soft bread, smoothies, noodles, and food engineered to surrender after 3 chews. They chewed tough meat, fibrous roots, seeds, nuts, dried foods, gritty plants, and whatever could be made edible by fire, stone, patience, and hunger. Sometimes tiny grains of sand or stone dust entered the food during grinding. Sometimes teeth were used like tools, holding fibers, pulling sinew, softening hides, or gripping materials when the hands needed help. That kind of life left marks. Teeth wore down, enamel thinned, edges chipped, jaws worked hard. A tooth might survive years of chewing only to crack on a hard seed, a bone fragment, or one unlucky piece of grit hidden in the meal. And once the protective surface failed, the inside of the tooth could become a doorway for pain. A small cavity, a fracture, or exposed dentin could turn eating into a careful negotiation. Every bite asked the same question: will this hurt? The ancient context was not the same everywhere. Some hunter-gatherer diets caused heavy wear, but not always the same level of cavities seen later in farming populations. Once people began eating more stored grains and carbohydrate-heavy foods, dental decay often became more common. But pain existed in both worlds. A worn tooth can hurt. A cracked tooth can hurt. An infected gum can hurt. An abscess can hurt so badly that the whole face feels occupied by it. And unlike a broken spear or torn hide, a bad tooth lived inside the body. You could not leave it behind at camp. You carried it into sleep, hunger, work, conflict, and conversation. In the ancient world, the mouth was not separate from survival. If the mouth failed, the body had to adapt, and the group often had to adapt with it. The evidence is written directly into ancient mouths. Teeth survive in the archaeological record better than many bones, and they carry a brutal diary of daily life. Heavy wear on chewing surfaces tells us that ancient diets could be tough, gritty, and demanding. Cavities show where decay entered. Abscesses leave marks in the jaw where infection drained through bone. Tooth loss before death can show that a damaged tooth did not simply disappear after burial. It lived with the person long enough for the body to respond. And the most surprising evidence is that some ancient people did more than endure. At Mehrgarh, in present-day Pakistan, researchers found Neolithic molars with tiny drilled holes dating roughly 500 to 9,000 years ago. These were not easy front teeth. They were hard-to-reach molars, and the holes suggest a form of early dental drilling, probably done with stone tools and bow drill technology. That does not mean ancient dentistry was gentle. It means people were desperate and skilled enough to try solving pain inside the tooth itself. There is also evidence of repair. A 6,500-year-old human tooth from Slovenia was found with beeswax placed on a cracked canine. Researchers interpreted it as one of the earliest known examples of a dental filling. Maybe it reduced sensitivity. Maybe it protected the exposed surface. Maybe it was applied shortly before or after death. The exact purpose is debated. But the object still matters, because it shows that ancient people noticed tooth damage and used available materials to cover, seal, or soothe it. The evidence also shows that diet changed the problem. Some hunter-gatherers had extreme tooth wear, while later farming populations often show more decay linked to starchy, stored foods. But neither lifestyle made the mouth safe. Wear, cracks, cavities, gum disease, and abscesses all left traces. Put together, the evidence says ancient tooth pain was not rare background noise. It was a real human problem, old enough that people drilled, sealed, pulled, softened, endured, and cared long before dentistry had a name. The mechanism of tooth pain begins with protection failing. A healthy tooth is built like a small fortress. Enamel covers the outside. Dentin sits beneath it, full of tiny channels that can carry sensation. Deeper inside is the pulp, where nerves and blood vessels live. When wear, cracking, decay, or infection reaches closer to that inner space, the tooth stops being a tool and becomes an alarm. That alarm can be brutal because the tooth is trapped inside hard structure. When tissue inside or around the root becomes inflamed, pressure builds where there is almost no room to expand. That is why tooth pain can feel sharp, pulsing, electric, or impossible to locate. The brain does not receive it as a polite message from one small object. It receives it through the jaw, face, ear, head, and sometimes the whole nervous system. Infection makes the problem worse. Bacteria can move through a cavity, crack, or damaged gum into deeper tissue. An abscess is the body trying to contain infection, but the swelling and pressure create intense pain. If the infection spreads beyond the tooth, the danger can become larger than the mouth. Without antibiotics, drainage, or proper dental treatment, a bad tooth could become a serious threat, so ancient solutions had to attack the problem from every possible angle. Reduce chewing pressure, soften food, use plants that numb, soothe, or reduce inflammation, clean debris from the mouth, press, scrape, drill, burn, drain, or pull when the damaged tooth became worse than the treatment. None of this was easy, clean, or guaranteed, but the goal was simple. Keep the person eating, sleeping, moving, and alive long enough for the pain to pass, the infection to drain, or the body to survive the damage. So picture a person awake near the edge of an ancient camp while everyone else is trying to sleep. The fire has fallen low. The group is quiet, but inside one jaw the night is not quiet at all. A tooth pulses with every heartbeat. The person presses a hand against the side of the face, then takes it away because touching helps for one breath and hurts on the next one. They are tired, hungry, irritated, and trapped inside a pain no one else can see. In the morning, food becomes a problem. Tough meat is impossible. Hard seeds are a threat. Even warm liquid touches the wrong place and sends a bright line of pain through the skull. Someone notices. Maybe an older person who has seen this before. Maybe a parent, a partner, a healer, or simply the person in the group who remembers which plant made swelling feel smaller the last time this happened. The group does not have a dental clinic. It has memory. They soften food near the fire. They offer water, chewed or crushed pieces, plant fibers, bitter bark, smoke, pressure, whatever the local world has taught them to try. Someone looks inside the mouth with concern because a bad tooth is not private for long. If the gum is swollen, if the smell is wrong, if the face is changing shape, everyone understands that this is more than complaining. Something inside the body is fighting. Maybe the pain fades after days, maybe the infection drains, maybe the damaged tooth eventually loosens and comes out, or maybe the group faces the oldest terrible choice: leave the tooth and let the pain continue, or remove it and create a new wound on purpose. Either way, the scene is not heroic, it is human. A small fire, a swollen jaw, a few people trying to keep one person eating, sleeping, and close enough to the group to survive until the mouth stops being the enemy. Here is the twist. Tooth pain did not only reveal how tough ancient people were, it revealed how much survival depended on other people. A person with a swollen jaw could not simply will themselves back into usefulness. Pain steals sleep, infection steals strength. A broken tooth can turn every meal into a problem. And in a world where food, movement, and attention mattered every day, a bad mouth could push someone toward the edge of the group very quickly. So the surprising part is not that early humans suffered dental pain. Of course they did. The surprising part is that many lived long enough for that pain to leave marks, for bone to react to infection, for teeth to wear down over years, for damage to be carried instead of immediately ending the story. That means survival was not only individual endurance, it was also adjustment. Softer food, shared food, rest, help from someone who remembered what had worked before, a group willing to keep a hurting person close while the mouth became a battlefield. That changes the way you should imagine ancient pain. Not as silent heroes calmly accepting agony because they were built differently, and not as helpless victims waiting for disaster. They were problem solvers inside bodies that hurt. They experimented with plants, heat, pressure, scraping, drilling, pulling, and care. Some attempts probably helped. Some probably made things worse. But the effort itself matters. The twist is that dentistry did not begin with clean white rooms. It began with pain, observation, and the refusal to let one damaged tooth decide whether a person could keep eating, sleeping, and belonging. Long before dentists, humans were already trying to negotiate with the mouth. So the next time a tooth hurts and you complain about calling the dentist, remember how strange that option is. You live in a world where someone can look inside your mouth with light, metal, x-rays, numbing medicine, sterile tools, antibiotics, and a plan. A pain that once could steal sleep for weeks can now be named, mapped, drilled, filled, drained, pulled, or treated before it becomes something worse. That is not normal in the long story of humans. That is a miracle with a waiting room. Your ancestors did not have that mercy. They had pain, memory, plants, fire, hands, sharp tools, and other people. They had to learn what could be chewed, what had to be softened, what soothed swelling, what made things worse. And when a damaged tooth had become too dangerous to leave alone, they could not escape the body. They had to work with it, suffer through it, and sometimes make brutal choices with no guarantee that the cure would be kinder than the problem. But this story is not only about suffering, it is also about how seriously humans have always taken pain. A toothache is small in size but enormous in experience. It can make the world shrink to one nerve, one jaw, one pulse in the dark. And still, across thousands of years, people tried to answer it. They drilled, they sealed, they pulled, they cooked softer food, they cared for each other. They turned pain into knowledge and knowledge into survival. So when you sit in a dental chair today, uncomfortable but safe, you are sitting at the modern end of an ancient struggle. The tools are cleaner now, the room is brighter, the pain can be numbed. But the old goal has not changed. Keep the mouth working, keep the body fed, keep the person alive, and keep one small tooth from taking over the whole human story.